Delirium and Dementia. Delirium is a type of mental confusion that comes on quickly, usually over a few hours or days. Patients with delirium may have the following symptoms, like trouble focusing their attention and are easily distracted, extremely mentally excited and restless, or quiet and drowsy. The key is look for hallucinations, illusions, or delusions. Sometimes what they say makes no sense, and symptoms may get better or worse at different times of the day. A common time for delirium to happen is during or after an older person is in the hospital or when they are recovering from surgery. The nurse's role is to prevent, early recognition, and treatment. So, prevention, early recognition, and treatment. The patient should be in places where there is a clear distinction between day and night, where others are present nearby, allowing personal exchanges, and facilitate activity during the daytime, such as taking a walk around the facility and light exercise. It's important to remove any dangerous objects and carry out rounds at night. Supportive measures are an integral component of effectively helping the patient with delirium. Creation of an optimal environment is essential. An effort should be directed at minimizing both overstimulation and understimulation, maintaining safety, maximizing the patient's ability to perceive the environment correctly, creating familiarity and consistency. To foster accurate perceptual experiences, it is important to assure that the patients utilize their eyeglasses, hearing aids, and other assisted devices. The warning signs of Alzheimer's. Memory loss. Forgetting recently learned information is one of the most commonly early signs of dementia. A person begins to forget more often and is unable to recall the information later. Difficulty performing familiar tasks. People with dementia often find it hard to plan or complete everyday tasks, and individuals may lose track of the steps involved in preparing a meal, placing a telephone call, or playing a game. Problems with language. They will forget simple words or substitute unusual words, making their speech or writing hard to understand. They may be unable to find the toothbrush, but instead ask for that thing for the mouth. Disorientation to time and place. People with Alzheimer's can become lost in their own neighborhood, forget where they are and how they got there, and not know how to get back home. Poor or decreased judgment. They may dress inappropriately, wearing several layers on a warm day or little clothing in a cold. They may show poor judgment, like giving away large sums of money to telemarketers. Problems with abstract thinking. Someone with Alzheimer's may have unusual difficulty performing complex mental tasks, like forgetting what numbers are for and how they should be used. A person with Alzheimer's disease may put things in unusual places, an iron in a freezer or a watch in a sugar bowl. Changes in mood or behavior. Someone with Alzheimer's may show rapid mood swings, from calm to tears to anger for no apparent reason. Changes in personality. The personalities of people with dementia can change dramatically. They may become extremely confused, suspicious, fearful, or dependent on a family member. Loss of initiative. They may become very passive, sitting in front of the TV for hours, sleeping more than usual, or not wanting to do usual activities. The overall goal is to reduce caregiver stress, maintain personal, emotional, and physical health, and cope with long-term effects associated with caregiving. There is no known method to reduce the risk of Alzheimer's disease. Antioxidants may be a benefit, but it's best to promote safety in physical activities. Recognize and treat depression. Early recognition and treatment is important. The nurse should inform patients and family regarding early warning signs and assess for depression and suicidal ideation. Counseling and antidepressants may be indicated. Family members may be in denial, delaying critical early care. The nurse should also assess family members and their ability to cope and accept a diagnosis. The goal of treatment is to control the symptoms of dementia. ACE inhibitors can be used to promote a cough in Alzheimer's patients. Beta blockers are used for aggression if dementia is related to CNS lesions. Medications are interventions, but you still need to discuss current topics with the patient. An intervention is to address them during the day and try to keep them on a day-night schedule. Look for ways as a patient trying to respond to a precipitating factor. Is it pain, frustration, temperature extremes, anxiety? The behavior is unpredictable and can be challenging. Behaviors are difficult to control and often lead to placement in institutional settings. The nurse's strategy is to address the difficult behavior. Redirection, distraction, reassurance. Do not threaten or restrain if frustrated. Assess the patient's physical status. What is their environment? Reassure them about their safety. Alzheimer's patients can experience sundowning, and they become more confused and agitated in the late afternoon or evening, and the cause is unclear, but as a nurse, remain calm and avoid confrontation. When talking to the patient, approach them from the front. Make eye contact and greet them by name. Do not communicate from behind or from the next room. Identify yourself with every interaction. Speak calmly, softly, and slowly. Be positive. Say, let's go to the rec room, rather than, let's not do this. Use short, simple, direct sentences with descriptive language, like, come sit here with me on this blue couch. Many times they do have fear of loss of a valuable possession. Offer to help the person to look and have duplicate replacements. Learn where their favorite hiding places are. The patient should be allowed to wear their own glasses and hearing aids. Offer liquids frequently. Finger foods may allow self-feeding. The short-term possibilities could be nasogastric tube or peg tube. In late stages, patients will be unable to perform their oral self-care and dental problems are likely to occur. The patient may pocket food, which adds to potential tooth decay. So inspect the mouth regularly and mouth care should be provided. Look at their body language as communication. If they are clenching their fists, they may be in pain. Avoid catheters. How can you tell if they're confused from an infectious process versus a disease process? If they're agitated, they may be hungry or cold. Other reasons for fatigue could be infections, constipation, or even medication side effects. Monitor their personal comfort and check for pain, hunger, thirst, constipation, full bladder, fatigue, infections, and skin irritation. Maintain a comfortable room temperature. Those with Alzheimer's disease may have particular dietary requirements such as extra calories due to the increased physical activity from restlessness and wandering. Supervise meals and help with the feeding. Patients with Alzheimer's often forget to eat and drink and can become dehydrated as a result. Elimination problems. It's best not to ask, do you have to go to the bathroom? Because many times they'll say no, and 5 minutes later they wet themselves. They're thinking about the question and don't realize the ramifications of their response of no. So next time say, it's time to go to the bathroom, Mr. Smith. Well, I don't want to, but it's time to try. And in a firm but gentle way, lead them to the bathroom and help them with their clothes. And sometimes that process of reinforcement will work, and other times maybe they really didn't need to go. Avoid being confrontational or arguing about facts. Instead, respond to the feeling behind what is being expressed. For example, if a person wishes to visit a parent who died years ago, don't point out that their parent is dead. Instead, say, your mother is a wonderful person. I would like to see her too. You're redirecting the person's attention. Try to remain flexible, patient, and supportive. Simplify the environment, the tasks, and solutions. Allow adequate rest between stimulating events. Provide security with safety locks on doors and gates, and definitely remove all guns. Usually the older shows are so much better. Shows like Lawrence Welk, Price is Right, Jeopardy. What's not good? Jerry Springer. So pearls is don't argue with the person because you're not going to win, and even if you do, there's no fun in winning an argument that nobody remembers. Don't confront, it only creates anxiety. Don't correct them if they misidentify you or drift into the past. And don't speak of them in the third person when in their presence.